点到8点，周六是9点到1点，而且有提供这个语言的翻译跟这个专门的这个服务。
And I'll just mention one statistic. We have received over 200,000 calls to our call center since we opened October 1st. So they are talking to many New Yorkers out there and enrolling many people into coverage.
那他补充就是光10月1号那天就有20万人打进来这个专线电话。
We also have a number of certified enrollment experts who are available to help provide assistance in the community at convenient locations.
那另外在社区里面呢，也有这个合格认证，就在社区提供个别服务的，主要有三类型的服务机构。
So there are 3 types of these assisters. We have in-person assisters or navigators, and we have several of them here today. We have certified application counselors, which are very similar to the navigators, also located in the community. And we have licensed insurance agents and brokers. All told, we have more than 5,500 expert assisters available. They've already been trained and certified and registered with the New York marketplace. That's 3,600 insurance agents and brokers, 1,300 certified application counselors, and 560 navigators. So we train about 120 of these assisters every week, so we will continue to add, and I know I heard the comment before, we could always use more. And this assistance is very important. I think there are many people who would rather sit down in person with someone who speaks their language in their community and walk through their options in person. Certainly some people are fine going on the website, doing it on their own, or with the help of someone by phone. But we really think these community assisters are a vital resource, and I would encourage you, again on the website, and we'll show the address again, we have a list by county where you can see the navigators that are located in your community, and we would encourage you to call and find out their hours or schedule an appointment with them.
那这3种个别服务的呢，分别是这个领航员，还有认证申请的咨询师，还有保险经纪人。那纽约州呢，一直都有提供这个受训，让很足够数量，比如说这个领航员就有超过500位，然后有提供不同的语言咨询，在他们的网站上呢，也可以直接根据你所住的这个 county 就你住的郡里面去寻找这个合格认证的领航员，来替你提供这些个别的服务，为个人跟家庭或者是小商家。
So really, we talk about the marketplace as the right place for New Yorkers, individuals and small businesses to find a choice of high-quality, low-cost private health insurance plans. We have 16 health insurers offered on the New York State of Health marketplace, and every plan that's offered on the marketplace offers a core set of essential health benefits. So this is comprehensive health insurance coverage. The benefits include prevention and wellness and chronic disease management, hospitalization, outpatient services, mental health and substance abuse disorder services, emergency services, lab and imaging, prescription drugs, rehabilitative and habilitative services, maternity and newborn, and pediatric dental and vision. We've organized the health plan options across 4 metal tiers. So you may have heard of the metal tiers. There's bronze, silver, gold, and platinum. Every plan offers the full array of health benefits I just walked through. And the tiers are really a way to help standardize at your choices, so you know when you're comparing across health plans and you're looking at the gold level, if that is the same cost sharing level, so what the amount that you pay when you go to the doctor, your copay, that sort of thing. That is what varies by these metal levels, but they all include the comprehensive set of benefits I just walked through. And there are important differences. So when you take a look at the metal levels, the platinum level, for example, has no deductible. So if that is important, that you don't have to meet a deductible, you may pay, they tend to carry a higher premium, but that's the trade-off. So I would encourage people to spend some time looking at these plan options and decide what's best for you. Every plan offered on the marketplace has been reviewed for its provider network, so they needed to meet a test that we set for the adequacy of their provider network before they could be offered on the marketplace. And then all of the state consumer and provider protections that have been known to the community are in place for all of the marketplace products as well.
那刚刚提到这个健保的交易市场呢是很完备，为这个个人家庭跟小商业提供一些高品质而且低价格的保险计划。这保险计划包含哪一些呢？第一个就是要有10项的基本保险，包括这个预防型、保健型、慢性病、住院门诊、心理治疗、紧急就医、化验、复健、处方药、孕妇、牺牲儿，还有儿科，包括眼睛跟牙齿。那另外他们也觉得很自豪，就是他们把这个4种等级呢，已经把它标准化了，从这个铜级、银级、金级到白金级，方便大家来做这个比较。另外也要求每一家健保公司呢，一定都要提供适当的网络内的医生来提供这个医疗服务，所有的消费者跟保险业者也都受到保障。
So this is a list of the health plans that are offered on the marketplace. Many familiar names and then some new names. I mentioned there are 16 total. There are 3 new health insurers in New York State that are being offered on the marketplace. That includes Oscar, North Shore, LIJ, and the co-op for New York, which is Health Republic. In addition, there are 4 plans that are new to this commercial market. So some of the public program plans, Affinity, Fidelis, Metro Plus, which is marketing themselves as Market Plus through the marketplace, and I'm forgetting one of ours, but Health First. So it's exciting that there are new health plan options available to New Yorkers, and the number of health plans, I think we're pleased with. 16 health insurers means there's competition, and I think that was contributed towards the premiums that we saw, and we'll speak about in a minute.
那这个现在看到的就是纽约州核可的16家健保公司。那这16家公司里面呢，有3家是新的，像这个Oscar、North Shore 这些。那另外也有一些以前是比较公营的，那现在也加入这个私营市场的，比如说 Affinity 啦、Health First 这几家 Metro Plus 这几家就是公司。所以现在我们纽约州有16家健保公司提供这个计划。
And of course, many familiar names as well. I should mention, while we're excited by the newcomers, we're also pleased that some of the old familiar names, Blue Cross and others, and United are also offering. I will say, I'll point, if I can do this right, the web address for the plan map. If you want to look on our website and look at your county to see what health plans are available to you, that's the web address for that plan map.
那所以他很高兴，除了有一些新面孔以外，那也有一些就这个长期服务的公司也继续留在这个加入这些健保计划。那另外他就指出，在这个下面呢，有网址上面有个 Plan Map， 可以根据你的住的那个郡里面去寻找，在你住的这个地方有哪一些健保公司是提供健保的。
Also on the marketplace are a number of qualified dental plans. So if you have the choice of purchasing your dental coverage with the same package as your medical care or separately. And so we have a number of qualified dental plans offered through the marketplace as well.
那另外在这个健保网站上呢，你也可以登记这个合格的一些牙科健保公司是分开的，不一定要同一家公司。就是如果你健保选了某一家，你的牙齿可以选另外一家。
And as I mentioned, the marketplace is the only place to apply for and receive financial assistance available to individuals and small businesses. I'll walk through what this financial assistance looks like. It comes in 2 forms. There are tax credits that will help reduce the cost of the premiums. So the eligibility for tax credits for a single adult, if you're earning less than $46,000 a year, you're likely to be eligible for this tax credit assistance, and families earning less than $94,000 a year. I mentioned before we have a premium estimator or calculator available on our website. If you just enter your household size, your income level, the county you live in, and the level of coverage you're interested in, we'll return for you immediately the health plan choices that you have in your county, what your full premium is, and then what the premium is after this tax credit assistance. There's also cost-sharing credits available. The eligibility levels for those are for a single adult earning less than about $29,000 a year, or a family of 4 about $59,000 a year. And what that is additional subsidies towards the out-of-pocket costs that people will pay at the point of service.
那刚刚也提到过，就透过这个交易市场呢，是唯一可以让个人、家庭跟小商业能够得到财务上的援助，也就是预支你抵税额来负担这个健保月费的津贴。那这种津贴呢是有2种形式的。第一种呢就是如果你的年收入是400%贫穷线以内，也就是个人收入在45960块以内，或4口人之家的收入在94200元以内，你都可以享受到程度不同的这个预支这个税务的来负担你的保费津贴。那另外一个呢是比较所以这个第一个是针对每个月的月费的部分，第二个部分呢是根据你自付额，它有一个降低你自付额的一种援助。这个年收入在250贫穷线以内，也就是成人的收入在28725以内，如果4口人之家的收入在58875元以内的话呢，它有一个方案是可以降低你自付额的一个援助，所以会透过这2种形式来达成它平价健保，帮助大家。
So I'll just speak a minute about numbers. We estimate that over the first 3 years we're open, we'll enroll 1.1 million New Yorkers through the exchange or through the marketplace. And we estimate that 3/4 of the individuals enrolling through the marketplace will be eligible for this tax credit assistance. So I think it's really going to have a wonderful impact on helping to make coverage more affordable and encouraging people to enroll in coverage.
那透过这种补助的方式，都会让大家更能够负担，大家更有意愿能够加入这个健保计划。
So the next 2 slides walk through some examples of the tax credit assistance. This first example will do Queens, since that's where we are. If we want to talk about an adult earning $20,000 a year, we estimate that the tax credit for that adult is $280 a month. And then they would see premiums that start at $80 a month available to them.
那刚刚这样子的举例可能比较不容易对号入座，所以他就举了一个假设是买银级的，住在皇后区，成人年收入2万块，就可以拿到这个税务上的优惠280块一个月，那自付的月费大概是80块以上。
And then similarly, a family of 4 earning $50,000 a year. We estimate they would be eligible for a $450 tax credit every month, and that their premiums for the 2 parents would face a premium of $268 a month, or that's where the premiums would start, and their children would enroll through our Child Health Plus program at a premium of $18 a month.
那举另外一个例子，也是在皇后区，如果是4口人之家，年收入5万块的话呢，大概可以拿到450块钱的津贴。那自付额的部分，家长是大概268块一个月，看选哪一家公司。那儿童保健的话呢，就是18块钱一个月。
And the web address where that premium estimator is right here. It's info.nystateofhealth.ny.gov premium estimator, and you can go on and it's very easy to see what your premiums would be.
那这个简单计算，你可以符合多少补助，你自付额多少的那个网址就在刚刚列的这个地方，然后上去以后会直接看到这个计算器。
And this is just a picture of what this premium estimator looks like. In the coming weeks, we are happy we're going to be putting out a web-based tool to make this premium estimator a little bit easier to use. So.
那下个开始它会另外一种可以上网的，让这个更容易使用。
And then finally, just to close with our website and phone number again, nystateofhealth.ny.gov, and our call center 1-855-355-5777. And I would just say thank you again for having us. We are very excited that in New York we're able to offer quality, affordable health insurance to all New Yorkers. We encourage everyone to come forward, see what you're eligible for, and we will happily enroll you into coverage in the health plan that works best for you.
那霍女士再一次提供网址跟这个热线的电话，也感谢大家，就是他们觉得很高兴能够在纽约州提供这么高品质、低收费的这个健保计划给大家。
Thank you very much for your speech, Ms. Hong, and also the World Journal would like to thank Flora Fong from Asian Americans for Equality to be the interpreter of today as well.
Mr. Yang, World Journal, and all the staff of World Journal for having such a wonderful event. This is my second time coming to a World Journal event, and I'm consistently impressed with the organization of the event, but more importantly, that it turns out so many New Yorkers who are interested in this vital information.
那卡女士呢，首先感谢杨社长、世界日报全体员工能够办这么好的健保论坛，让大家都能够多了解。这是他第2次受邀。
Forums like these are incredibly important. There are big changes that we're all trying to get a handle on, and without these kind of forums, healthcare reform anywhere, but particularly in New York and in New York City, will not happen the way we want.
像这样的论坛真的非常重要，因为我们面临一个很大的一个转变，所以只有提供更多正确跟最新的讯息，才能够大家都得到帮助。
So I want to take some time to clarify where we in New York City fit in the big picture of healthcare reform. So you know, and you've heard from Ms. Holohan, healthcare reform is a federally designed but state-run operation.
那首先呢，他当然要厘清一下角色，就是说，当成前一位霍女士的，大家都明白，这是一个联邦设计，但是是州营运的健保计划。那市政府在这里扮演什么角色呢？
But it's important for us to recognize that New York City is and always has been a leader in providing health insurance coverage. In New York City, virtually all children, over 95%, have health insurance. Some of the best rate of the biggest cities in the United States.
纽约市呢一直在这个推动健保计划扮演一个重要的角色。在我们纽约市呢，有90%以上的孩童都是有得到健保 cover 的，都是靠市政府去帮助他们登记。
For a long time, New York State has been at the forefront of policy changes to expand access to coverage, and our mayor, Mayor Bloomberg, and my commissioner, Commissioner Dorr, have really worked diligently in making those policies real for New York City residents, making them meaningful, and providing information to you about the coverage that is available to you.
那纽约州政府一直在领先，在政策上面推动，但是市长还有他们的署长也都积极的在运行，来帮助大家推行这些健保计划。
For the past 13 years, I have led an office called the Office of Citywide Health Insurance Access. And that office has worked diligently also to increase access to health insurance for New York City residents.
在过去13年呢，他工作这个单位是全市一个健保事务执行署在市的人力资源局下面。这13年间就是不断的帮助大家了解还有外展这些健保的计划。
We work with many public and private partners, including partners like the Charles B. Wang Community Health Center, to educate New Yorkers about health insurance options and how they can connect to coverage. We also create city-specific tools like the NYC Health Insurance Link, our own website, that has information to help individuals and businesses understand their health insurance options.
所以过去他们就一直透过这个公家跟民间的合作，像跟王家莲这个中心呢，有不同的这个方式去外展给大家，然后让大家了解，然后登记。他们也有一个自己专属的网址是 New York Health Insurance Link， 然后来帮助大家做了解健保计划。
Many of you today have probably seen some of our documentary materials. We have provided some fact sheets with regard to reform and how to get ready. We've provided them in English as well as Chinese, and we're making them available in other languages so that your fellow New Yorkers also will understand how important this time is and how they can take appropriate action.
那他们也做了很多的传单一些资料，然后翻译成不同的语言，让大家都能够理解多了解一些这些健保的资讯跟一些登记的方式。
But let me get to today's theme, because I think that it is helpful to reinforce some of the things that Ms. Holohan said about this time, the New York State of Health, and what's available to New Yorkers.
那现在他想要带回主题，也是连接刚刚霍女士的专题演讲为什么这个做这样的论坛对购买健保对移民是重要的。
Today's theme is how the Affordable Care Act influences the Chinese community.
今天的主题就是这个健保为什么对我们中国移民社区重要呢？
And I think the most influential factors for the Chinese community, Chinese American community here in New York City, are many of which will apply to all communities in our city come down to 5 key facts about how health insurance is changing.
那这对我们重要，因为有5个很重大的改变，我们都必须要了解的。
Those 5 facts are: most uninsured residents under 65 will be able to find out if they're eligible for public or private health insurance in one marketplace, known as the New York State of Health, using one application.
那第一个重大的改变是，只要是65岁以下的居民呢，在纽约州只要透过一个健保交易市场，就可以比较公家的跟民间的所有健保资料的符合资格跟登记跟比较。
They can find comprehensive health insurance plans through the New York State of Health.
然后他们也可以在这个网站上找到所有提供的这个健保方案、健保计划。
Many of the uninsured will qualify for financial help, as Ms. Hollihan spoke about, with health insurance plans through that same marketplace.
那很多以前没有健保的人，现在也可以透过这个交易市场来取得这个税务预支的这些优惠，来支付他们的健保月费。
Something that many of you have heard about in the news about the Affordable Care Act, that it requires almost everyone to get health insurance by January 1.
另外一个改变就是这个平价健保要求所有的居民都是要购买的，所以是法律，这个是要求的。
And important for the small business owners in our audience, that businesses with fewer than 50 employees can get insurance through the New York State of Health that is comprehensive and allows them to offer their employees a choice of health plans.
另外一个改变就是，即使是少于50个全职员工的小企业，也可以透过这个交易市场来给员工保险，而且这些小企业也可以取得税务上的优惠，最多可以税务优惠可以到他们负担这个月费的50%。
But even more important to businesses than the ability to offer coverage through this vehicle is the ability to obtain tax credits for up to 50% of their premium costs. And again, only through the New York State of Health.
那另外就是说，小商业除了透过这个网站可以取得这个健保很方便资讯以外，因为税务上的优惠，在财政上也会帮助到他们。
So those 5 facts are important generally for Chinese American New Yorkers. But I want to speak specifically to some important considerations for immigrants in New York City.
那这5个方面当然是一个很大的改变，所以对我们移民，尤其是中国移民社区是一个很重要的。那另外它也有一些要提醒的事项。
If you live in New York and are a citizen or lawfully present immigrant, you can get insurance through the New York State of Health or this state's marketplace, even if you've moved here from another country.
第一个就是说，只要是你住在纽约那你就是公民或者是这个绿卡，你都可以透过这个交易市场来取得这个健保，即使是你刚从另外一个地方搬到纽约来。
If your preferred language is not English, there is help for you in the marketplace, in their call center, and also through navigators and other certified assisters.
那即使英文不是你的母语呢，你也可以打这个客户服务，他们都是有讲中文的。那另外还有很多领航员或其他这些专业人士，也都是可以讲你的语言的。
And important to know about navigators and other state certified assisters, they are there for free.
那就是导航员还有州合可的很多协助者，其实提供的服务都是完全免费，你不需要负担任何费用。
You don't have to pay them for their help to you.
所有的帮助都是不需要负担费用的。
Any personal information that's provided to the New York State of Health or its exchange is used solely for the purpose of determining eligibility for health insurance.
所有健保申请的时候缴出去的资料只是用来核可健保资格的不会外泄。
It should not impact your immigration status.
绝对不会影响到你未来申请移民或调整身份的时候有任何影响。
Most people will have to pay a penalty in 2014 if they don't have health insurance. You have until March 31st. We hope you will act, for those of you that are uninsured, sooner than that.
那这个2014年如果没有保险的话呢，会要付罚款，因为是一个全民健保。那最后一天登记呢是2014年的3月31号。当然，他希望大家能够更提前做好准备，完成登记。
But it's important to keep in mind that this is a requirement of the Affordable Care Act.
那很重要就是说，这是一个法律上的要求，每个人都需要购买，都需要有保险的。
Undocumented immigrants, however, will not have to pay a penalty.
如果是没有身份的移民是不需要付这个罚款的。
If you don't have health insurance and you need care, you are fortunate in living in New York City in that we have the largest city hospital system in this city, the Health and Hospitals Corporation.
那如果你没有保险，但是有需要的话呢，在市政府的这个医院网络里面，也有一个公共医疗制度，可以提供你这个就医的一些服务。
And we also have local community health centers that will provide care on a reduced fee basis depending on your income.
另外有一个根据收入来衡量你可以负担多少这个医疗服务费的公立医院，还有一些地方都有提供这些医疗服务。
I want to speak a little bit more about the benefits that are available to undocumented immigrants. And they are benefits that are available now, and they will continue to be available in 2014 through federal health care reform. Things like Child Health Plus for children.
那他这里呢就要提到一些市政府有提供的一些医疗保健计划，在过去有提供医疗保健，在未来2014年也会继续提供的。第一个就是儿童保健。
All children can get Child Health Plus regardless of their immigration status.
所有的孩子都可以拿到19岁以内都可以拿到这个儿童保健，即使是没有身份的孩子。
And Child Health Plus is a public insurance program available for children under age 19.